About 1/3 of Americans say they have skipped meals, borrowed money, or cut back on utilities to pay for health care. That's in a Gallup poll released in March. The Trump administration has lowered prices on more than 50 drugs, but it also let premiums rise, even double, in the Affordable Care marketplace, and made the biggest cuts ever to Medicaid. Already, 3 million have lost insurance, and it's estimated it'll be 10 million in 3 years. All of this reminded us of our story in 2008 about a charity called Remote Area Medical. RAM started out parachuting doctors into South American jungles, but in the 1990s it turned to another isolated people, Americans, cut off from health care by the cost. Recently, we returned to RAM at one of its free pop-up clinics. For Americans long on pain and short on hope, RAM is a ray of mercy in the darkness. The parking lot in Knoxville, Tennessee, began to fill early. In a frigid February, many drove hundreds of miles in desperation. Nearby, Remote Area Medical would open a clinic inside an empty exhibit hall. But RAM can take only so many patients on a weekend, so they joined the line days before. We met Sandra Talent at 5 a.m. Sandra, where did you come from?
Huntsville, Alabama.
And how long have you been in the parking lot here?
Since 4:30 Wednesday night.
Wednesday night.
Yeah.
So Wednesday night, Thursday night, and this is Friday morning. 2 nights sleeping in her car, a 200-mile drive, all for lack of dental insurance. If you didn't have RAM, how would you get your teeth taken care of?
I wouldn't.
A few spaces over, Dave Bird spent the night in his truck, aching for a full set of dentures. What happened to your teeth?
Several things. I had a uninsured drunk driver run a red light doing 80, hit me head on, almost killed me. 2 years of rehab and 3 surgeries, and $140,000 later, I was able to go back to work. At work one day, I'm drilling through a basement wall, and the drill hangs up on a piece of rebar, and it comes around, smacks me in the mouth, cracks my jaw, and broken back out again. By then, I was pretty thin on money to do much about it, so I didn't have a lot of choices. I just kept working.
But working was rare. Employers on construction jobs just assume he lost his teeth to meth addiction. Burge told us his only habits are nicotine and caffeine, and right now he could use a cup. He's wrapped in 4 layers against 27 degrees. If you didn't have Remote Area Medical, what would you do?
Suck. No other way around. They're life-changing.
Life-changing.
When they hand you your life back, that's life-changing. That's what teeth mean to me. I can be a normal human again.
I sure do appreciate you.
Yes, sir.
Thank you. Good luck.
Yeah.
Your dentures. Okay, you're going to be over here.
He had the luck of being near the head of the line,
Y'all go right in here.
which stretched to 1,200 patients in Knoxville over a Friday, Saturday, and Sunday.
Hold on to that. When you go up there for service, you got to bring them that ticket if you don't.
Brad Sands, a former paramedic, is a RAM clinic coordinator.
I'm number 4.
Number 4, head on up.
Who are the people in the cars?
Everybody. I mean, it's your neighbors, it's your parents, it's your friends, it's the community around you. It's everybody. And it's nationwide.
Somewhere in America, Brad Sands sets up a clinic like this most every weekend. It's all comers, no questions asked.
No insurance needed. You don't even have to give me your real name.
We met a woman at a RAM expedition who was so grateful for the help she received. But she said, I just hate to ask.
I'm not going to judge your story. Nobody here that's working or volunteering today is going to judge any person that comes through that door. We are here to help.
Can you see any of those lines lines out there?
About half of the patients have no insurance. The rest have insurance they can't afford to use because of copays and deductibles. And many health insurance plans have no dental,
Correct.
no vision care,
Correct.
no hearing care.
Correct. This is our triage area. So once
Chris Hall volunteered at RAM when he was 12 years old. Now, he's CEO.
So when you look at the patients that come through our door, 65% of those patients are requesting dental service. 30% of those patients are requesting eye exams and glasses. Only 5% are requesting medical care. Dental and vision are two things that are isolated that people do not have access to or can't afford the access to.
Are you diabetic?
There's also screening for blood sugar, blood pressure, breast cancer, skin cancer, and more. Depending on the size of the clinic, RAM will spend between $100,000 and $500,000 over a weekend. How do you pay for all of this?
It's the generosity of the public. Over 81% of our supporters are individual donors, people that write $5, $10, $20 checks every month.
Those checks are leveraged with donated clinic space, donated supplies, and volunteers. 887 volunteers on this Knoxville weekend alone.
This sheet here is extremely important.
Medical professionals paid their own way from 30 states and brought medical students with them.
Treat these patients with dignity, with respect. Talk to them like they're human beings, please.
If you ever lose faith in humanity, go spend 10 minutes at a RAM clinic. You're going to see hundreds of people there that are donating their time, and they're coming out and they're donating large swaths of their own money/time to help their neighbors.
I remember there was a guy many years ago who had a broken tooth, and he told me that he tried to remove it with a screwdriver. So if that doesn't move you to help, that's the desperation. Let's see what we got here.
Dentist Glenn Goldstein volunteered from New Jersey. He sees patients suffering from a past without health care and no hope for the future.
I've had young people in, I said, well, some of these teeth can be saved. You know that, right? Because, I don't care. Please, I don't have any money. I don't have any way to get these fixed. So please take them out.
I got a bunch of loose tooth and broke tooth, and this is bothering me, so I'm ready to get them all out.
And it's heartbreaking to take all the teeth out. It's terrible.
Patients ask you to take all of their teeth out.
All their teeth.
Let's see. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 16.
Because they know going forward they will not be able to take care of them.
100%.
Relieving pain was the mission of RAM's late founder, an eccentric Englishman, daredevil pilot, and Amazon cowboy. Tell me about Stan Brock.
Stan was a magnificent leader, magnificent man, humble.
We basically had...
We met Stan Brock and RAM in 2008.
We're very happy that you're here this morning. We've got a lot of really fine volunteer doctors, dentists, eye specialists. It was built in...
Stan was an adventurer who once walked 26 days in the Amazon to be treated for an injury. So he started his airborne medical charity with an Army surplus C-47 that flew on D-Day. When we met, he was 72, had no family, took no salary, lived in an office donated to RAM, and showered with a garden hose. He died in 2018 in the office. He was perhaps the most dedicated person I've ever met.
I agree with you completely on that. I joked around a lot when I tell people working with Stan, it was really hard to ask for a day off when your boss hadn't had a day off in 20 years.
When we met in 2008, Stan Brock was staging 12 clinics a year. After our broadcast, $4 million in donations poured in along with thousands more volunteers. RAM has grown from a dozen to 90 clinics a year.
It's because of you and your story back in 2008 that brought me to almost to tears. And as soon as your segment was over about this organization, I immediately went online, looked it up and registered down here. I'm from Jersey.
I understand that volunteering at RAM has become a family thing.
Yes, sir. Yes, sir.
Got one left.
So my son, who's here with me now, my wife has been here, my daughter-in-law, my daughter, my other son, they've all been here a multitude of times.
Sounds like you get as much out of this as the patients do.
Maybe more.
Did you have high blood pressure or anything like that?
Only when I'm in pain.
Remember Sandra Talent, the woman we met in her car?
What is your chief complaint?
And Dave Burge, who lost his teeth in 2 accidents. They're here for dentures, a process that would take weeks were it not for this trailer and the 22-year-old engineer who helped build it. Connor Gibson uses computer design to make dentures with 3D printers. They can print a set in an hour or so. Gibson has slept in here to keep the printers running nonstop. He's inspired by something he calls the mirror moment.
We say it's worth $1 million, but truly, it's priceless. When you give them that mirror, you just see all that stress melt away. And no matter if they're 18 or 80, here, we see grown men cry sitting in the chair.
You guys are ready.
And so it was for Dave Burge, the man who told us in the parking lot that he wanted to be a normal human again.
You're a new man.
Thank you.
There we go.
All right.
And the mirror smiled on Sandra Talent.
Looks good.
Yeah. Yeah.
Happy tears?
Yeah.
What does this moment mean to you?
I don't know what I'd do. You know, the Lord would make a way, but I feel like He has made a way through Ram.
Over the Knoxville weekend, RAM allowed more than 500 patients to see, 700 live without pain, and restored the smiles of 24. With insurance out of reach for growing millions, RAM will hurry to another city to make health in America a little less remote.
Oh, you look beautiful.
Do you think they look pretty?
Yeah, you look gorgeous.
Good.
Seriously.
Good.
You look so pretty.
Thank you for being here, honey.
Seriously. Have a great day.
You too.
Have a great life.
Get some sleep.